Title: Treatment for Hodgkin and AMP, Non-Hodgkin Lymphomas by Pharmacology. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. They also provide catering services for events and have a selection of fashionable clothing items for sale. Message them on Instagram at CoffeeFirstCup to receive generous discount codes. Introduction: Non-Hodgkin lymphoma, NHL, presents as a complex and diverse spectrum of diseases characterized by variations in histopathological features and disease extent. While nodular or follicular lymphomas generally demonstrate a more favorable prognosis, diffuse lymphomas pose significant challenges, necessitating tailored treatment approaches. This overview delves into the clinical characteristics and treatment strategies for NHL subtypes, highlighting advancements in therapy and their impact on patient outcomes. Hodgkin and non-Hodgkin lymphomas. The treatment landscape for Hodgkin lymphoma has undergone significant transformation over the past 5 decades. This lymphoma is now widely acknowledged as a B-cell neoplasm characterized by rearranged VH genes in malignant Reed-Sternberg cells. Moreover, up to 80% of tumor specimens contain the Epstein-Barr virus genome. A comprehensive staging evaluation is imperative before devising a definitive treatment strategy. Notably, for patients with stage I and IIA disease, there has been a notable shift in treatment paradigm. While extended field radiation therapy was previously standard, concerns regarding its long-term adverse effects, including hypothyroidism and increased risks of secondary cancers and coronary artery disease, have prompted a shift towards combined modality therapy. This approach entails a brief course of combination chemotherapy followed by involved field radiation therapy. For advanced stage 3 and 4 Hodgkin lymphoma, a significant breakthrough occurred with the advent of MOPP, mechlorethamine, vincristine, procarbazine, and prednisone chemotherapy in the 1960s. Although initially yielding high complete response rates and cures in a substantial proportion of patients, the anthracycline-containing regimen ABVD, doxorubicin, bleomycin, vinblastine, and dacarbazine has emerged as a more effective and less toxic alternative. Typically, 4 cycles of ABVD are administered, while the Stanford V regimen offers another option, comprising a 12-week course of combination chemotherapy followed by involved radiation therapy. With these regimens, over 80% of previously untreated patients with advanced Hodgkin lymphoma, stages 3 and 4, are anticipated to achieve complete remission, with alleviation of disease-related symptoms and objective evidence of disease disappearance. Overall, approximately 50–60% of all Hodgkin lymphoma patients achieve cure. For patients with refractory disease, immune checkpoint inhibitors such as nivolumab and pembrolizumab have gained approval. These agents target the programmed cell death 1, PD-1, receptor expressed on T cells, thereby enhancing T-cell immune responses and stimulating T-cell activation and proliferation within the tumor microenvironment. Non-Hodgkin lymphoma. Non-Hodgkin lymphoma, NHL, manifests as a diverse disease entity, wherein the clinical characteristics of NHL subtypes are intricately linked to underlying histopathologic features and the extent of disease spread. Generally, nodular or follicular lymphomas exhibit a considerably more favorable prognosis, boasting a median survival of up to 7 years, in stark contrast to diffuse lymphomas, which typically yield a median survival of merely 1–2 years. For patients with diffuse NHL, combination chemotherapy serves as the cornerstone of treatment. The CHOP regimen, cyclophosphamide, doxorubicin, vincristine, and prednisone, featuring anthracycline, has traditionally been considered optimal for initial therapy. Notably, randomized Phase 3 clinical trials have demonstrated superior outcomes with the addition of the anti-CD20 antibody rituximab to CHOP, showcasing enhanced response rates, disease-free survival, and overall survival compared to CHOP chemotherapy alone. In cases of relapsed or refractory diffuse large B-cell lymphoma resistant to multiple systemic therapies, CAR T-cell therapies, including tisagenlecleucel and axicabtagene ciloleucel, offer significant clinical efficacy by targeting CD19-expressing lymphoma cells. Nodular follicular lymphomas, characterized by low-grade, indolent growth patterns, often present at an advanced stage and primarily involve lymph nodes, bone marrow, and spleen. Despite advancements in therapy, this NHL subset remains challenging, particularly when diagnosed at an advanced stage, rendering it largely incurable. Consequently, treatment is primarily palliative. Presently, there is insufficient evidence to support the immediate initiation of combination chemotherapy over a strategy of close observation and watchful waiting, with chemotherapy initiated upon the onset of disease-related symptoms. Conclusion. In conclusion, non-Hodgkin lymphoma, NHL, represents a multifaceted disease entity necessitating a nuanced understanding of histopathologic subtypes and disease extent for optimal management. The evolution of treatment strategies, from combination chemotherapy regimens to innovative immunotherapies like CAR T-cell therapy, has significantly improved outcomes for patients with NHL. However, challenges remain, particularly in the management of relapsed or refractory disease and the balance between aggressive treatment and palliative care for certain subtypes. Continued research efforts and collaborative approaches are essential to further enhance treatment efficacy and improve the quality of life for individuals affected by NHL. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video.